Welcome to the County Health Rankings and Roadmaps webinar, Resident Engagement to Achieve Racial Equity. My name is Attica Scott, and I'm an action learning coach at County Health Rankings and Roadmaps. The County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. This program is the result of the contributions of many colleagues and partners in Wisconsin and across the nation. Today, I am joined by my colleague, Carla Freeman, who is also an action learning coach with our organization. Hey, Carla.
Hi, Attica. Hi, everyone. We're excited to be here. I will be managing the Q&A, the question and answer. So if you have any questions, feel free to put them in the box and I'll get to them as soon as I can.
Thank you so much, Carla. I also want to take a moment to introduce you to a couple of other colleagues who are joining us to enhance your learning experience. Erica Burrows-Girardi will be connecting with you in the chat box. Erica is also an action learning coach. Hey, Erica.
Hi, Attica, and hello, everyone. Welcome to our webinar. And I will be engaging with you in the chat box today. If you would, please make sure that you use that drop-down box to chat to all panelists and attendees, and that way everyone can see your comments. And I'm looking forward to engaging with you in the chat. Thanks.
Thank you so much, Erica. And our technologist, James Lloyd, will take care of any of your technology issues. Hey, James.
Hi, Attica. It's great to see you. We probably won't have any problems, but if you do have a problem, you can instant message me in the chat window, and I'll do what I can to help out.
Thank you so much, James. So I also want to invite y'all to join us after the webinar to dig a little bit deeper into today's topic. So immediately following this webinar, we will offer an interactive discussion group to exchange thoughts about how strategies related to today's topic work in your communities. These conversations give you a chance to be face-to-face with other webinar attendees and share what you are doing locally, as well as ask questions of other participants. We are pleased to be able to offer these sessions in partnership with Healthy Places by Design, and Joanne Lee with Healthy Places by Design will be our lead facilitator. So watch out for the chat details about how to connect later in the webinar. We will be sending that information as we approach the closing, so check for Erica to put that in the chat. Now I want to introduce you to our honored guests. Dr. Tori Harris, MPH, is the Health and Equity Strategist for the New Orleans Health Department. She also serves as adjunct faculty at Xavier University of Louisiana in the Public Health Sciences Department, teaching Master of Public Health students. In her role as equity strategist, she works to incorporate a racial equity framework into the structure and function of all programs of the health department. Dr. Harris has dedicated her 20-year career in public health to addressing health disparities, community development, and community organizing. Dr. Harris earned her bachelor's degree in chemistry at Xavier University of Louisiana, Master of Public Health at Tulane University School of Public Health and Tropical Medicine, and her doctorate in public health with a concentration in health behavior and health systems and services management from the University of Kentucky College of Public Health. Hello, Dr. Harris.
Dr. Harris is muted.
I'm sorry.
Yep.
I still haven't learned. Good afternoon, Attica. Thank you for having me. I look forward to speaking with you and our participants today.
Thank you so much. We'll get back with you in just a moment. Dr. Ira Murray is the president and CEO of the United Way of the Capital Area in Jackson, Mississippi. In this role, he provides strategic leadership and oversight of United Way's fundraising, community impact, and administrative functions. Prior to this position, he was a K. Leroy Irvis Fellow at the University of Pittsburgh Center for Urban Education, whose scholarship focused on systemic racism and youth social political development in traditional and non-traditional education spaces. Welcome so much to you, Dr. Murray.
Thank you, Attica and the team, for having me, and I'm looking forward to the conversation.
Thank you so much, and we'll get back with you as well in just a moment, Dr. Murray. And I just wanted y'all to know that Drs. Harris and Murray We're both part of the Delta Region Action Learning Cohort of County Health Rankings and Roadmaps this year, and both have asked that I refer to them as Tori and Ira during this webinar. So you heard me mention the Delta Region Action Learning Cohort that County Health Rankings and Roadmaps offered this year. That cohort focused on building authentic engagement in the Delta region. As we get started today, let's begin with the why of County Health Rankings and Roadmaps, why we exist. County Health Rankings and Roadmaps has two primary overarching goals. The first is to improve health outcomes for all. This includes both how long people live and how healthy they are. The second is to close the health gaps between those with the most and least opportunities for good health to increase health equity. Today, we're going to talk more about resident engagement to achieve racial equity. Later in the webinar, I'll share more about our action learning guides. One of those guides focuses on partnering with residents. In that guide, you'll find this definition on your screen of resident engagement. And it really is working with people who are impacted by your efforts as equal partners. This includes a range of practices to increase resident awareness and participation, to cultivate ongoing feedback and input, and to support active resident leadership by creating conditions for residents to lead and be involved in transformational efforts. So that we are on the same page during this webinar, I'll share this definition as well of racial equity, acknowledging that different definitions exist for many of the terms that we'll use today. Racial equity is defined as the proactive reinforcement of policies, practices, attitudes, and actions that produce equitable power, access, opportunities, treatment, impacts, and outcomes for all. Racial equity is the systemic fair treatment of people of all races, resulting in equitable opportunities and outcomes for all. And racial equity goes beyond anti-racism, but because it is not just the absence of discrimination and inequities, but also the presence of deliberate systems and supports to achieve and sustain racial equity through proactive and preventive measures. So on that note, I want to welcome back Tori and Ira so that we can dig into this conversation around resident engagement to achieve racial equity. So I want to start, we're going to have a conversation. So I want to start with you, Tori, and ask if you can talk about how you are engaging residents, especially during COVID-19 and this global pandemic.
So working for the health department, I've been engaging residents in a couple of ways. One, particularly in the beginning of the pandemic, advising our director on community testing and how we should reach community residents who are disparate in New Orleans with testing. So I managed the testing sites, also managed giving residents their results, and then also serving on a number of community coalitions across the city. All of those coalitions pivoted to tackling how do we reach residents to get tested and wearing their mask and so on. The other thing that I've done is participated in the Delta Region Cohort with some coalition members from other community work, and we were trained on how to engage residents at a deeper level. So just making sure that I'm in tune with the outreach of all of our community engagement work across the city.
Thank you so much. Appreciate you. And Ira, can you talk about what racial equity looks like in your work and what are some of the barriers to achieving racial equity?
Thank you for the question. And again, just happy to be here. Unlike the Steelers wide receivers, I want to try not to drop the ball on this one. I just had to throw that out there for my Steelers fans in the chat because I see y'all. So to answer your question, I think race equity, I think the definition that you have really is a great anchor because I think of race equity very similarly. And I think of it in two ways. One, I think of race equity as a state, right? It's a noun and a verb. So to me, one of it is a state. And so to your point, it's not just the absence of racial inequalities or inequities, but also the presence of justice. It's the presence of healing. It's the presence of racial reconciliation, and also the presence of atonement. Is these actions, is these states that people feel whole, not just along the things that we can measure, but often along the things we can't measure. You know, are we psychologically whole? Are we emotionally whole? Are we, is there an empathy gap? Is there an understanding gap? You know, all of those things go into producing inequities. So they have to be a part of racial equity in and of itself. And then the action part is really so important. It's because it's ongoing work. There are forces that create inequities and perpetuate inequities that are always at play, because inequities are inherently systemic and institutional. And so in order to counteract these, we have to be in a constant state of action, because oftentimes these inequities permeate unconsciously. And many times we all kind of, you know, participate in, you know, knowingly and unknowingly in perpetuating these systems and these institutions. So it requires constant maintenance. To me, it requires constant reflection, course correcting, and evolution. And if we're really going to get to the point of achieving racial equity. But again, it's not just simply, you know, closing what we see as achievement gaps. We also have to identify opportunity gaps and making sure that the conditions that bring racial inequity into place are no longer there as well.
Thank you. You talked about racial equity being about a noun and a verb. So we're going to talk more about that action to achieve racial equity. Just want to remind folks, if you have questions for our guests, to please be sure to put them in the Q&A, and Carla will lift them up in a little bit. So I'd like folks to be able to leave the webinar with the ability to talk about resident engagement and racial equity constructively. So how are you having these conversations, Tori? Can you talk a little bit more about the work that you are doing in New Orleans?
Sure. So one of the ways that I have the conversation is facilitating healing circles with our leadership team at the health department. And I gained training around doing that through human impact partners. I participated in a leadership training, in actually 2 cohorts of the leadership training, where we were trained on how to facilitate race conversations in our local health department. And the key component to that is the healing circles, like Dr. Murray spoke of. And it allows us to layer on aspects of our identity, but while also deepening relationships with one another. And so over time, you know, we become familiar with each other and the work that we're doing, and it peels back some of the onion, so to speak, on who people really are. And I've translated that work into even my classroom with my students, because, you know, leadership is tough, and understanding who you are as a person is important to your leadership style and how you serve in terms of being equitable within your communities. And it also allows you to identify some of your own internalized issues that have traumatized you from racism. So I think healing circles by far is the best way to have the racial equity conversation. And I know a lot of people think, oh, you know, we don't need to do that. I don't have that ideology, but it really helps you to get to understand who you're working with and who you're working with in the community as well. So I think that's the main way. And I can't say enough about human impact partners, because they're really on the ground, training leaders on how to have these conversations.
Thank you so much. And I'm hearing you and Ira say some similar things here: atonement, healing, so important to lift up. So I want to ask you, if you can, Ira, talk about how communities can actually achieve racial equity, both in the short term and the long term.
Yeah, so I'll start with the long term, because I think that's really, I think that's really so important, and it's really kind of what's on the top of my mind. And I always underscore, you know, policy, policy, policy. Like, I can't underscore that enough, because as we've seen and talked about, you know, racial inequity is systemic and institutional. Policies are really what change those things. Policy is what changes institutions. You know, we often look at, you know, why this individual leader, why this individual politician wasn't able to make more change when they were in a position of power. And I always say, well, it's because the systems and the institutions are much more stronger than the people. than an individual person, but not more strongly than,
Mm-hmm.
right? And so the policy is really where we have to hone in at. For us, you know, in United Way, one of the things that we're doing that I'm really excited about, we do it in about 22 to 24 states currently. In Mississippi, we're going to start this project next year, is what we have what we call the ALICE project. So ALICE, like the name, is an acronym for Asset Limited, Income Constrained, Employed. And it's a movement throughout the United Way network of really digging into the lived experiences of families who live above the poverty line, but still struggle to meet their essential household needs every month, right? We used to call it the working poor, but it's a lot deeper than just being poor, because a lot of ALICE households you would look at from the outside and not think they're poor, all right? But because of the economic factors that we've been having to deal with, and this particularly hits Black, Brown, and Indigenous communities harder, we see that it's very difficult for these families to meet those needs. So one of the things that the ALICE project does is it takes several different data sets, everything from federal data to state and local data, combines these data sets and really does a more in-depth analysis to really pinpoint what's the actual cost of living in a community, how much it's changed over a decade or so, and then what does this mean for people who live in those communities and work in those communities. So for instance, in Louisiana, and I'll take Torrie's home state, Louisiana, they've done, I think, 3 ALICE studies already. And one of the things that they found was that for a family of 4 who lived above the poverty line, if you had, you know, a child who was pre-kindergarten and a child in elementary school, your expenses went up over the course of 6 years by 33%. But for everyone else, and if you looked at it just in the aggregate, expenses may have gone up about 10%, right? So it's really digging in and figuring out what people's experiences are, and then looking at it by race, disaggregating that data and saying, okay, how are Black households, Brown households, Indigenous households faring compared to their partners, compared to their peers who are white? And they're really able to dig in more deeply, not only pinpointing the racial differences, but also in some instances, communities, what specific communities are really struggling with this. So the policy really is so important. And why I say that's policy, you know, they were able to use that ALICE data in part to advocate for an increase in the state earned income tax credit. Why is that important? Because that's money that goes directly back into the pockets of hardworking, lower income families who are disproportionately Black and Brown in many of our states and communities. So that's the kind of work I think that can really go into eliminating racial inequity. In the short term, you know, honestly, if I had an answer, I would bottle it up and distribute it to every community, because I think it's really tough. But what I will say, what we found a little bit of success in our early childhood work is really looking at some of the low-hanging fruit, I would call it. Some of the policies where some of the institutions and systems where you have relationships where the leader, the person who can make decisions, is someone who's already on your team, already like-minded, someone you already have access to, and just start pinpointing little, you know, specific areas. Say, hey, can we work on kindergarten readiness? Can we work on, you know, 4-year-olds meeting their benchmarks? Can we work on the lowest performing elementary schools being better in 1st and 2nd and 3rd grade so that students pass their 3rd grade literacy exams? You know, we can start in those areas and then expand to larger systemic issues that can ultimately have more long-term impact.
Thank you. You said something, I want to make sure I heard it correctly, that basically policy is bigger than a person, but policy is not bigger than the people. Is that, man, that's pretty powerful.
At least that's what I was trying to say. You said it a whole lot better than I did.
So during COVID-19, we've heard a lot about policy, right? And I know that y'all both were part of the cohort talking about building resident engagement. So how are you both building authentic resident engagement in this virtual world? And I'll start with you, Tori, to hear about the work that y'all are doing.
So I wanted to also go back to your first question about one of the things that I've been doing during COVID, and it does relate to what Dr. Murray said about policy, is that I worked with the mayor's office on developing a COVID-19 equity recovery plan, because our governor had started an equity task force And as the person leading equity at the city in the health department, I said, well, we should have something that focuses on equity as well. So I devised just a couple of strategies to deal with racial inequities in our city, chipping away a little bit at a time, but sitting down and having those one-on-one conversations supported, access to the community as well. And participating in the cohort allowed us to really use the action planning worksheet to really hone in on what the issues are in the city. And despite New Orleans having a reputation for food, we have food insecurity. And it's persistent and historical over decades, in particular in Black communities. And so that allowed us as a coalition or as a group, New Orleans Community Voice, to say, how do we, undo some of these systematic or institutional things that are happening that are continue to persist in these neighborhoods that also bring forth the culture for the city, which attracts people to come and visit. And so we were able to do a little focus group with the neighborhood engagement office online on Zoom and get their feedback. And even though we had a few people on the call, they were quite vocal about what the issues were. And it wasn't necessarily, health related. It was really about infrastructure, about feelings of isolation, about not having transportation, and just not having a grocery store in their community that sold fresh, healthy vegetables at an affordable price. And so that's how we're working to do that, despite not being able to be in person because we're a very social community, but leveraging our culture and degrees of being social with one another through Zoom to get their feedback, and just making sure that we remain in trusting relationships with the community, that we don't abandon them, that we're continuing to communicate with them and not making promises that we can't keep, but always keeping them informed about what's going on at the city level and throughout, and providing resources as well.
Thank you. And that seems to me to be key to what we're talking about, is building relationships, right? You said it's not just resources, but it's also relationships. Or it's not only resources, it's also relationships. So thank you for that. How about you, Ira? How are y'all working to really build authentic resident engagement in a virtual world?
Yes, so a lot of what Dr. Harris just said, one of the things we did on the front end of the pandemic, early summer, was we developed a series of online town halls where, every session we had a different topic that was really present on people's minds. So we did it, on education. We did it on early childhood development in a pandemic. We did it on small businesses, not just what they're going through, but what resources they have access to. So we tried to, one, make these accessible to folks. We did them by Zoom, but we live streamed them on our social media so that anyone on Facebook could interact with us in real time. But then also it's archived there for anyone to go ahead and see it later. And then we also partnered with our local ABC affiliate in Jackson to develop a public affairs show that we ran on Sundays. Where we basically talked about all these important, it was a weekly show, and we talked about all these important topics, everything from the flag, Mississippi State flag being changed, to what systemic racism looks like in economic development, in access to health resources in the midst of a pandemic, to school reopenings and distance learning. So we wanted to make sure we had those public conversations as well, and then invite people to continue the conversation with us online. And we've really tried to use this period as a listening and data gathering period, right? So part of it hasn't been as much focused on what services we can deliver, even though we've done a lot to deliver services during the pandemic, particularly with food and distance learning for children. But it's also, as we're doing those things, we're gathering stories. And I want to underscore this part because it's so important. The storytelling and story gathering is really, really crucial. I'll talk about this a little bit later in the last question, but it's really crucial for us to create spaces for communities to tell their own stories. And that's what we try to do through some of our work is as we are handing out food, as we're engaging schools and parents in terms of getting access to technology so their children can have a better chance at distance learning, we're in conversation with them to hear from them to know what their real lived experiences have been and continue to be during the pandemic. So that when we are able to get face-to-face with folks again to do community conversations and things like that, we're coming in with a little bit more knowledge about what's happened over the course of the past 9 months or so than we would have had we just kind of gone about our daily business, just kind of giving out grants and let everything just kind of let the chips fall where they may. So this opportunity, particularly with our cohort in the Delta Region Project, we're focused on crisis response in rural communities. And so we identified local organizations who are working with families in our target areas every day to kind of, one, get some background and learn a little bit from them. And then once the new year hits, we'll be in those communities delivering crisis preparedness packets to those communities while also gathering data in terms of surveys and conversations with families who get the kits, so we can have a little bit more information so that we know that we can provide resources that are going to be helpful for them in the future.
Wonderful, thank you. And is the weekly show still running?
We're not weekly anymore. It's kind of as needed. We ran for, I want to say 13 weeks. And now it's more of kind of whenever something comes up, we'll do something.
Okay, awesome. Thank you. Thank you both. Just a quick reminder, folks, if you have questions for our guests, please put them in the Q&A after these couple of questions. I'll turn it over to Carla to lift up your questions. So this question's for both of you. What are some mistakes to try to address or avoid when building authentic resident engagement? I'll start with you, Tori, because I know we've talked some about this.
So I've been doing equity work probably for most of my career. And I think I've had to evolve because one of my colleagues, she says, culture eats strategy for breakfast. And I used to be in the academic mode of, tackling equity, using objectives and things like that. And I realized that if the mindsets don't change, or you don't have a leader who is ready to have the discussions about racial reconciliation and healing, your strategy is pointless. And it'll just sit on a shelf. And so I had to adjust how I did the work. And so that meant, having deeper relationship with the leadership teams that I work with. And so I think, though you need a strategy and a plan, what steps are you gonna take? I think we have to be less focused on that and focus and allow the relationship to guide the strategy. And don't be too quick to just write a plan and say, here you go. Take the time or build in the time to do the relationship building with your community or with your leadership team so that you can have authentic engagement with one another and in the community. And people think it sounds hokey, and I did too in the beginning. But I think I've seen the benefit of doing the relationship building and allowing that to guide the strategy. People can think more effectively about equity and race and actually have the conversation in a safe space with one another. And that's also key, having a safe space with one another that gives people the opportunity to tell their story. And so, because otherwise, public health really hasn't changed health disparities in the last 20 or 30 years. So we have to be inventive or innovative in how we approach having these discussions, or we'll be back in the same place.
Mm-hmm. And thinking about the missteps to try to avoid or to address, you said culture eats strategy for breakfast. Wow. That's something to sit with and think about. Thank you. What about you, Ira? What do you suggest folks try to address or avoid as far as missteps go?
Yeah, I'll talk about to this day what is, I think, my biggest misstep. And it's actually a mistake I often, not often, but occasionally repeat. So it's a work in progress. But for me, the most pressing thing was thinking that I knew someone's story when I just knew of their story, and knowing the difference between the two, right? So I'll give you an example. When I started my United Way work in 2005, my first big project was Hurricane Katrina recovery and relocation. So overnight, we had about 30,000 people from Louisiana and the Mississippi Gulf Coast who relocated to Jackson, Mississippi, in the wake of Hurricane Katrina. And so part of what I did was I was managing a assistance program where we provided financial and other assistance for folks who were permanently relocated. And so I would meet with families, and I would meet with individuals every day to talk through, what their needs were and see what we could do to assist them. Well, I thought I was empathizing because, with so many of the people who came to my office looked just like me, from communities just like mine. And I thought I knew, what they had gone through, right? Until there was this one lady in particular, I'll never forget her. And she was crying in my office about, because she was traumatized. And I told her, I said, well, I understand, I know what you're going through. And she looked at me, she said, no, you don't know what I'm going through. And that sat with me, that has sat with me for 15 years. And I think about this periodically every several weeks, right? Because at that moment, I realized that I didn't take the time to really understand and hear her story. I felt like I knew her story. And so I had to reflect on myself to say, okay, everyone's story in this situation is the same. But also, you don't know someone's story until they tell it, right? And we all are the only, for all of our lives, we're the only people that are going to be in our life for the entire story, 100% of the time. So no one can tell our stories better than we can. And so from that day forward, I always caution myself and anybody I'm working with in engagement to say, take the time to really know the story. Don't assume you know someone's story. Take that time. It's invaluable. One, because you'll learn much more than you ever thought you were going to learn, but also it gives that person the power and the control over what happens after that. And so that's the misstep I would advise people to avoid if possible. Take the time to really listen and learn about the story before you start moving to the next step of your work.
Thank you. Power and control, that is also at the core of racial equity. Thank you both. As we close out this conversation with one another and get to Carla's questions, I do have one last question for y'all. And this is really your feedback to the audience. So what do you both challenge our viewers to do in their own backyard every day as it relates to resident engagement to achieve racial equity? And I'll start with you, Tori.
Well, I think I've been, kind of saying that throughout the conversation. I've had to challenge myself to be uncomfortable in these conversations about race. And, as Ira spoke of, not thinking that I know everybody's story because they look like me, and understanding their perspective and realizing that we all come from different backgrounds, whether they look like me or not. So they're coming to the table with that. And so taking the time to just really challenge myself to learn more through relationship, and pushing myself to sit in being uncomfortable about the conversation. Because for me, if I'm not uncomfortable and pushing myself to learn or to grow and reach across the table to other people, then the result is that we're going to stay the same. And that thought is terrorizing to me, because I want to see some change. The community wants to see change. And so whatever I have to do to be present in the moment, to deepen my relationships with the community is absolutely critical. And I think as academicians, teaching and being in the health department, we often separate ourselves from the community, even though we're helping them. We think we know what's best for them. And we don't. We have to go out and talk to them. It has to be consistent. It has to be sustainable. If you look at the vaccine hesitancy around communities of color. They don't trust providers, the government, to work with them. And so how do we overcome that? We have to be persistent, and we also have to prioritize public health in our budgeting and spending. And I'm challenging myself right now. How do I frame that message to our mayor to prioritize spending on public health as for the social determinants of health as a racial equity issue? And so just strategizing with your community members through trustworthy relationships is probably the best thing that you can do to overcome racial equity.
Thank you so much. And I noticed that Erica asked the question in the chat to the audience. So I may come back to Erica after your response, Ira, just to see if maybe she has a couple, 2, 3 examples of what people commit to do when they go home. So Ira, what about you? What do you challenge our audience to do?
So my suggestion would be, or my challenge would be, to look inward. I'm a strong believer in a reflective practice. And you're talking about an everyday thing to do. I would ask myself, these questions, every day, or at least, once a week. One is, how did I come to learn what I think I know about this community? Where did you get your information from? TV, newspapers, the actual people who live there, people who have historical knowledge, where does that come from? Then ask yourself, what do I not know about this community that I need to know? Then ask yourself, who have I not learned from? Who have I not heard from? And that lends to the next question is, whose voices are not at the table? And really think long and hard about that, because there are so many people who are who've been made invisible in society, whose voices will teach us the things that we really want to know. And then, once you've asked yourself those questions and answered those questions, then you work to fill those gaps in. And that's really kind of where I begin and end with this kind of work. I'm constantly asking, okay, why have I not heard from this group? Why have I not heard from this group? Most of the time it's because I haven't done what I need to do to engage that group. So then how do I engage that group? Who has access to that group? Who are the gatekeepers? Who do I need to talk to in order to really get a good understanding? And then go into those conversations, assuming I know absolutely nothing. And then taking what I learned from those and compiling, and then double checking and making sure that I'm processing and hearing things correctly. If we do those things in resident engagement, look, this is tough work. I mean, anybody who doesn't know it's tough work. And there's no magic bullet to it. But I think starting from there and focusing on how we are positioning ourselves in those groups is going to help us be more effective in the way that we engage those groups.
Awesome. Thank you. Thank you both for responding to that question and issuing those challenges. So I'm going to check in with Erica to see if she wants to lift up maybe a couple, 2, 3 examples of people that they commit to doing in their own backyards.
Yeah, and let me just start by saying the chat is so active, Dr. Murray and Dr. Harris. Thank you so much. You're sharing these awesome just wisdom with our viewers, and they are so appreciative of both what you have to share your knowledge and your humility. So we wanted to know, like, what are you planning to do to address racial equity after hearing this conversation? And I want to start by acknowledging Jarena Storm. That name will sound familiar to both Dr. Murray and Dr. Harris because Jarena was part of the Delta Action Learning Cohort with them. And so she's joining us today from Fort Smith. But Jarena is planning to deepen her relationships with her community. And we had Margaret, who says the information here is helpful, and she's going to be doing stories with residents where she is, and she's going to like push to get that resident engagement and hearing those stories, push to get that started right away. So I was excited to hear that. Cheryl's talking about the importance of reminding people about the social determinants of health, particularly those who are in positions of power, that they need to understand that those social determinants of health do affect health outcomes. So thank you so much for sharing your views and your responses in the chat about how you're going to take action. I encourage you to keep responding and letting us know. We are just tickled pink by what folks are planning to do. Thanks, Attica.
Thank you so much, Erica. And now I'm going to turn it over to Carla for the next 10 minutes or so to facilitate the Q&A with our guests. Carla, it's on you.
Wow. The questions have been deep and long, so I'm going to try to summarize some of them. I think the one of the main ones that's come up is this whole notion of systemic racism, and racism as a public health issue, and how we're sort of parsing out the historic atrocities that has happened in order to get some of the work done. And I am really summarizing because there were some very deep questions there. And then I think more importantly, how do you continue to maintain this momentum that we have in this moment to continue this going forward? And then finally, how are we interacting with Zoom and in these times? So those are sort of as quick as I could encapsulate all of them. So however you want to facilitate that in terms of our speakers, Attica, to answer some of those or at least begin to touch on them. And then one more thing I want to encourage people, there is a discussion group directly after this presentation. So for those of you that didn't get your questions answered or had wanted to go into a deeper conversation, you can also, the link will be provided towards the end of this presentation, but we want to let you know that there is another opportunity to have a deeper discussion about these issues.
Thanks, Carla. That was a lot. So could you lift up a couple of questions, maybe one at a time for Tori and Ira to respond to?
Well, I think the systemic racism piece, and I think both of you being in one in Mississippi, one in Louisiana, you're very familiar with that and doing this work in that environment, maybe talking a little bit about the public health aspect of how we're continuing to still move these issues forward with that backdrop.
I saw somebody in the comments say something about, this sounds good if, your political decision makers are ready to do this work. And I'm not saying any of this by any means to say that it's been easy or that people were just ready to jump on board. It took maybe 3 iterations of me, going back to the table and saying, how can I approach this differently? And a part of that was my own understanding of, or my healing journey around race as well, because I would get to a point where I would say, okay, I'm not doing this anymore. And I'd have to go back and do my own reflection. And so I think what's helped me over time is having a group that I could relate to, and that I found that group with Human Impact Partners, where we practiced pushback with practicing the different things that a leader might say to you if you present this information to them. And we took about 4 people and we would practice what we call pushback circles, where, we enact the potential pushback you could get from that decision maker and then practice a different way to frame the message. And so I think in doing that and having those sessions, I was able to go back to the table or back to the leaders and say, hey, let's try it this way. And so I think the important thing is to evaluate the readiness of the leaders and wanting to have this conversation, talk it over with your crew, as we say in New Orleans, and see if it's a good way to go about implementing that strategy. And most of the pushback is in wanting to do it in equity in a very academic way, but having the conversation with that leader to see what their perspective is definitely helped me to reframe. But it is especially being a Black woman who's also experienced racism herself, I get tired. And so I have to refresh myself and find ways to protect my mental health. But I know, again, the end result is I want to see change. I want to see the undoing of some of these policies that have oppressed communities of color in my community. And so I think evaluating the readiness, finding your crew to practice these pushback circles, and knowing that it's going to be a process, that it may not be, today I presented my strategy and tomorrow we're free of all the ills in our community. You have to recognize that it's just going to take time, and you need the language to frame your messaging. But one more point is that I'm working to frame the message that public health should be the champion of racial inequity because of the social determinants of health. So if you can link and encourage people to focus on public health as the leader in undoing institutional racism in your community, I think that might be a good path. But you're going to have to make the case based on the data in your community.
Yeah, I'll piggyback very quickly. I think that was tremendous. I mean, I don't really have a lot to add. I will say this, and I'll just highlight this in Mississippi. When we talk about systemic racism, in Mississippi in the last election cycle, we had three ballot measures that passed that are they're all three progressive ballot measures that I think if you'd asked people 5 years ago would this have happened in Mississippi, they probably would have told you no. One was the changing of the state flag to a flag that did not have the Confederate symbol embedded within it. One was the passing of medical marijuana in the state of Mississippi. And then the other was the revocation of a Jim Crow era law, which required any state-wide elected official to win not only the majority of the votes, but also the majority of the counties in the state of Mississippi. And that was put in place explicitly to prevent Black people from getting statewide office, because the thought was even if they won the general, they would not win the majority of the counties. And if they didn't, it would go to the legislature to decide the winner, and the winner would be whoever the white candidate was. Now, why do I say all those things in this conversation? When we talk about systemic racism and we talk about policy, don't think for a second that all three of those things aren't policy. Don't think for a second that symbols are not policy. Don't think for a second that medicine and the availability of medication is not policy. Don't think for a second that being able to elect the person that you want to see in office is not policy. All of these things are policy, and all of these things have a very profound racial component to them. Obviously, the Jim Crow era election policy was explicitly racist, but also when we think about medical marijuana, we think about the way that Black people are under prescribed pain medication, particularly Black women, because people don't believe Black people feel pain the same way that other people feel pain. And largely part of it was this pathologizing of Black people that we would abuse opioids, we would abuse pain medication, when actually you see, that actually isn't the case. Actually, the abusers of pain medication typically end up being middle-class white people, right? But Black people aren't getting the medication they need. Now with medical marijuana, that opens the door for more equitable pain medication in medicine, right? And of course, having a symbol of a constant reminder of slavery in the Jim Crow South every day, that's policy. That affects people's mental state. It affects their psychological state. It sends messages about their place in society. So even in Mississippi, when people think about, oh, Mississippi is a very conservative place, Mississippi is a place that's behind on these kind of things, these things can happen, and these systemic changes can happen when you have a critical mass and a combination of an intergenerational, interracial coalition of folks around these same ideas who, one, can explain it, but then two, have the ability to get in front of the people around the state. And you'll find that there are more people who agree with these anti-racist, with these progressive policies that we might actually think about, just because we're often conditioned to think that people are going to assume things to be a certain way. So, there's possibility. even in places like Louisiana and Mississippi. We just have to be able, to Tori's point, to have these conversations, to really be able to put each other in uncomfortable positions, have these conversations, but then don't end those conversations with discomfort, end those conversations with understanding, empathy, and a mutual dedication to creating a better society. And we can make these changes that we're talking about, even when they seem insurmountable.
Wow, that was powerful. What a way to end. Carla, thank you so much for lifting up that pretty much an umbrella question to encompass what folks were asking. Thank you so much. Y'all, I just want to thank our guests, Dr. Ira Murray and Dr. Tori Harris, for joining us today. They're going to go on over to the discussion group in a few minutes, where y'all might be able to dig deeper into this conversation, but also lift up your own issues, concerns, thoughts, and challenges. And we are going to begin to close out the webinar. But we're curious, though, about how much your understanding of how to build authentic community engagement or resident engagement has changed during this webinar. So I'm asking our technologist, James, to launch a quick poll. We will not be sharing the results with the audience, so your response is anonymous. And thank you so much for participating in this poll. And as you are, we see the poll, it's active. Oh, look at that. More than half of y'all have responded. All right. Thank you. Okay. All right. There we go. This helps us to work on our continuous quality improvement for future webinars. Thank you for helping us with that. Look at that. We're almost at 3/4 of the participants completing the poll. Thank you.
Attica, while that poll is being filled out, I want to let folks know you should be able to save the chat by clicking on the three dots next to the drop down box. Please go ahead and save that chat. I know a lot of people said that there's so many good things in that chat and they want to be able to reference it later. So be sure to save your chat. We do not share the chat with the audience, so make sure you save it.
That's so helpful. Thank you so much, Erica, because I would imagine that our guests, Tori and Ira, might want to go back and look at the chat as well, since they weren't able to engage because they were the guests. So thank you for that. And thank you so much, James, for launching the poll. Before we go, I also want to remind y'all that I mentioned the action learning guide called Partnering with Residents earlier in the webinar. And all of the action learning guides have been created with you in mind, and they are self-paced interactive guides that blend guidance and tools and hands-on activities, all designed to deepen your learning around a topic. So I encourage you to check them out. Erica is going to be chatting a link to the Partnering with Residents guide to you now. And please know that we will also include it in our follow-up resource guide that Carla mentioned, and you'll receive that later this week. In that resource guide, we'll also include links to the County Health Rankings and Roadmaps Facebook page, Twitter profile, and the e-news. So let's be sure to stay connected. James also chatted out that you have to close the poll box yourself in order to see the screen again. I also want to share with you that our January webinar will bring together 3 guests to share diverse experience with language justice. So save the date for Tuesday, January 26th. Our colleague, Ali Havrilla, who's also an action learning coach, will be the lead producer for that webinar. So please save the date, hold the date, mark your calendar for Tuesday, January 26th, where we'll be talking about language justice. And then we'd love to hear from you, right? We're all about continuous quality improvement. So please share your thoughts on today's webinar with us. Erica will be sharing a link to a brief evaluation in the chat. So please click in the chat and complete the evaluation after the webinar. So basically, click the link, keep your web browser open so that you can complete the evaluation once we end the webinar. We do look at your feedback closely and use it to improve our webinar. So thank you in advance for sharing your thoughts with us. And I'm going to encourage our guests, Ira and Tori, to head on over to the discussion group because you're going to have folks join you in just a few minutes. So we want y'all to be comfortable and ready for us in just a few minutes. So again, if once you receive that link for the evaluation survey, please click on it, leave your web browser open, and complete that evaluation after the webinar. And we invite you to join us for more discussion. We'll be over there in a few minutes. So as we close out, we do want to acknowledge that we have the discussion group that's scheduled right after this webinar. As I mentioned at the top of the hour, Joanne Lee with Healthy Places by Design will facilitate the discussion. And Erica is placing the discussion room link in the chat right now. We'll see you over there in just a few moments. And thank you so much for your time today. Thank you again to our amazing guests, Dr. Tori Harris and Dr. Ira Murray. Thank you so much to Carla Freeman for managing the Q&A and to Erica Burrows-Girardi for managing the chat. And as always, to our amazing technologist, James, for making sure that we're able to keep the webinars flowing and going for you. Thank y'all so much for joining us today. We'll see you over in the discussion group.